And to health matters now, the Nigerian Red Cross Society is set to raise an emergency appeal fund of $4.7 million to expand their reach and address the growing demands in at least 12 states in Nigeria, where the outbreak of diphtheria is at its peak. The National President, Nigerian Red Cross Society, Adiaga Aditayo, while speaking at a press briefing in Lagos, condemned the high level of vaccination hesitancy from mothers. Sarah Ayeku reports.
Diphtheria spread to 20 states in Nigeria, but it is most severe in 12 states, with Kano having the highest number of new infections. The Nigerian Red Cross Society in its latest briefing explains the lack of active case finding, contact tracing, and vaccinations has resulted in the 20% plus fatality rate, with 117 children dead from the outbreak in Yobe State alone.
Nigeria's diphtheria outbreak is not just a collection of statistics. It is a devastating crisis that has families mourning the loss of their loved ones and communities in despair, especially those aged 0 to 14, who may never have been previously vaccinated, bear the brunt of this disease.
In the last few weeks, we've seen quite kind of like the curve of the outbreak is kind of uncertain because this outbreak it hasn't occurred in Nigeria for quite some time, and then we are also receiving reports of the outbreak spreading out to the border of Niger Republic as well. So it was really, really important for Nigerian Red Cross to continue this intervention.
Diphtheria is a severe bacterial infection that can affect a person's nose, throat, and occasionally the skin. With the outbreak taking on an unusual trend, the agency seeks to help about 5.4 million at-risk individuals with an emergency appeal fund of $4.7 million.
The outbreak, as noted by technical analysis, is the worst in a decade and may escalate further without immediate intervention. There have been viral videos on social media discouraging people from getting vaccinated. I want to use this platform to advise citizens to ignore any baseless information and instead focus on getting the proper health care for themselves and their children free of charge.
The next phase of tackling this outbreak is supporting the Nigeria Center for Disease Control with increased community surveillance to understand the trend of the outbreak across Nigeria. Sarah Ayeku, TVC News, Lagos.